Good afternoon. I'm Joe Himley, Interim Dean of the School of Social Work. It's indeed my honor to welcome you to the Conversations Across Social Disciplines panel discussion. This annual program is an opportunity to increase dialogue and to create models for working across social science and social work disciplines to find connections and opportunities for bridging boundaries. The program is designed and implemented by doctoral students at the School of Social Work with financial support from the Joseph Veroff and Katherine Pavelka Luke Fund. This fund was established with gifts from School of Social Work faculty members, Letha A. Chadiha, Beth Glover-Reed, and Barrett Ingersoll Dayton, along with gifts from family and friends in honor of these two respected and loved scholars and mentors. Joseph Veroff and Katherine Pavelka Luke represented different generations, interests, and disciplines, but they shared many personal and scholarly characteristics, including actively navigating across multiple boundaries, promoting positive conditions, not just preventing negative ones, taking action for change, and valuing connections and balance in one's personal, family, and work life. It's now my distinct pleasure to introduce the doctoral student coordinator for this event, Matthew Bakko. Matthew is a fifth-year PhD candidate in the Joint Program in Social Work and Sociology. He is an organizational scholar with critical concern for how social service systems, organizations, and providers advance both oppression and liberation. Matthew addresses this concern by exploring how social service organizations are impacted and engage with their external environments, including policy shifts, funding and resource dynamics, and political changes in their institutional and community contexts. His current work and dissertation research specifically focuses and explores social service organizations that interface with carceral systems. For his dissertation, Matthew is studying cities that have shifted resources and responsibilities from police and other criminal legal systems to social services, exploring how social service organizations mediate efforts to reduce punishment and advance more caring approaches to community safety. Matthew, I now pass it on to you to begin our program.
Thank you so much, Dean Himley, and welcome everyone. First, before I begin, I would like to say that live audio transcription is enabled for this event, which you can enable or disable at the bottom of the Zoom screen. My name is Matthew Bakko. I'm a PhD candidate in social work and sociology at the University of Michigan. For a visual description, I have light-colored skin, blonde hair, and I'm wearing green glasses and a purple shirt. In the room behind me is a bookcase with white walls and a couple paintings and bowls. I use they and he pronouns. I am so honored to facilitate this panel and be joined by esteemed faculty members in social work and the social sciences. Over recent years, a renewed spotlight has been cast on the role of social service systems and social workers to provide care-based alternatives to systems of punishment, including incarceration, state surveillance, and policing. As many social change agents continue their long-standing work to dismantle punishment and build more caring and even liberatory institutions, social workers and those in social services have been tasked with exposing and changing the ways that our social service systems can exacerbate oppression and inequality through punishment-oriented practices and policies, whether in child welfare, healthcare, workforce services, and in many other service areas. This panel was formed with that task in mind, treating change in and new models of social service systems as objects of inquiry and concern. We are inspired by abolitionists including Dr. Ruth Wilson Gilmore and her assertion that we must not only dismantle violent oppression, but simultaneously do the work of building life-affirming institutions. It is a fitting theme for an event sponsored by the Joseph Veroff and Katherine P. Luke Fund, as Katherine Luke's work focused on preventing violence. Today, we'll facilitate interdisciplinary dialogue between scholars whose research and practice cut across social work, anthropology, public health, and law, among other disciplines. We hope to facilitate some enlightening and challenging dialogue towards building life-affirming policies and practices across a broad array of social service settings. So now let me introduce each of the panel participants. First, we have Dr. Melissa Burch, Assistant Professor of Anthropology at the University of Michigan. Dr. Burch is an anthropologist whose research and community work focuses on the experiences of people with criminal convictions in the United States. Her first book will focus on the discriminatory use of criminal background checks in the job market. Welcome, Dr. Burch. Second is Dr. Mimi Kim, Associate Professor of Social Work at California State University, Long Beach, and founder of Creative Interventions and co-founder of Insight. Dr. Kim's work challenges gender-based violence at its intersection with state violence and creates community accountability, transformative justice, and other community-based alternatives to criminalization. Welcome, Dr. Kim. Third is Dr. Sophia Sarantakos, Assistant Professor at the University of Denver Graduate School of Social Work. Dr. Sarantakos' work aims to facilitate the reduction of the size, scope, and power of the prison industrial complex while understanding and amplifying non-carceral approaches to harm and need. Welcome, Dr. Sarantakos. Finally, we have Dr. Jelena Todić, Assistant Professor of Social Work at the University of Texas at San Antonio College for Health, Community, and Policy. Dr. Todić's work focuses on the social determinants of health and health inequalities, with an interest in cultures, infrastructures, and praxis that grows health-affirming places. Welcome, Dr. Todić, and welcome to the entire panel. We first have a series of questions for the panel, but we will also leave room for audience Q&A at the end. For those of you who are attending, please place any questions that you have in the Q&A box as the panel progresses, and we will be monitoring that as we go along and leave plenty of time at the end for them. So we'll begin with the first couple of questions that are for all the panelists. First, to get us started, this event takes seriously the dual goals of dismantling harmful and punishing social service and related systems, while also building life-affirming institutions of care and liberation. To situate our conversation about care and liberation, though, we'll first discuss punishment and harm in social services. I want to ask every panelist to please introduce themselves, their research and practice, while also introducing this opening question, which is, how do you see punishment and harm entrenched in the systems and practices you study and work in? And we'll start with Dr. Burch.
Thank you so much, Matthew. Hello, everyone. I'm thrilled to be here with all of you. Looking forward to the conversation. My name is Melissa Burch, and I have for most of my adult life been focused on the question of how to challenge the United States' reliance on strategies of surveillance, policing, and imprisonment as its primary response to problems that we understand as fundamentally social, political, and economic. I've approached that work in a variety of ways in the early 2000s as an organizer with Critical Resistance, and later as part of the staff of a reentry program for women coming home from prison in Los Angeles. And it was there doing reentry work for several years that I began to learn firsthand about the challenges that people face who are coming out of prison, as well as the long-term stigma and exclusion associated with having a criminal record. Right? And also that's where I began to think about the role of social service organizations in the struggle for prison and industrial complex abolition and for liberation more generally, right? In terms of how I see punishment and harm entrenched in programs designed to assist former prisoners and reentry programs in particular, it's fairly easy to see those connections, just in the sense that many reentry programs get money from and are contractually connected to the criminal legal system, right? And therefore sort of obligated through their contracts to report violations of parole, for example, someone staying out past curfew, traveling without authorization, etc. Many such programs themselves also require adherence to rigid rules, right, that mirror the kinds of rules that are required inside of prisons, such as mandatory participation in programming, required sobriety, regular drug testing. And again, many reentry programs report violations of those rules to parole and probation officers. So those are, just sort of the obvious connections that come to mind. But beyond these sort of obvious ways that even community-based reentry programs might extend punishment into community settings, one of the more subtle ways I would say that I have seen programs for formerly incarcerated people or people with convictions perpetuate harm is by kind of upholding and reinforcing dogmas of personal responsibility and individual choice in a way that downplays or even denies what we think of as the kind of root causes of crime, and the ways that criminalizing systems deliberately target people who are most marginalized, right? So in other words, in the kind of day-to-day work of trying to help formerly incarcerated people succeed, there's an emphasis on individual agency, which is to some extent logical and necessary, but which, if not approached carefully, can reinforce the idea that people who have been systemically oppressed are responsible for their own condition and uniquely, on their own and by their own will can get themselves out of those situations. I'll stop there.
Thank you. Dr. Kim, same question.
Hello, everybody. Thank you for this invitation. I just want to say a little bit more, I think, for visual description, that I am an older Asian woman, East Asian, Korean American woman with long black hair and a black dress. And I am standing in my bedroom as I have for 2 years. And my background is a cream colored wall with, I would say, knickknacks, a lamp, and some other things on a little shelf behind me. So I have been doing work at the intersection of looking at communities of color, women of color, and domestic violence and sexual assault interventions for a long time. I've been doing that work actually since the late 1980s. I've been thinking about it deeply since that time. There's so many different ways to answer the question about the connections. And for the sake of time, this is kind of introductory, so I could certainly speak more to this more extensively as we move on in this webinar. But I think a lot of you know that carceral feminism is something that is now a term that is more and more familiar with people. So it clearly ties feminist anti-violence movements that I have been part of, an active part of for decades now, with the carceral system. The ways in which a feminist emancipatory movement has ceded its power and collaborated with the most masculinist, most repressive, most violent institution of the state is something that has concerned me, enraged me, and motivated a lot of my political activism and academic scholarship for a long time now. So I was also there active in the work in 1994 when the Violence Against Women Act was first passed as part of the crime bill. And that became a moment of kind of a crystallization of how far we as a movement had gone towards tying ourselves to law enforcement. And I think it was a catalyst to more of us coming together and wanting to do something about that. I'm going to stop there, and we'll speak more to this as we move forward. Thank you.
Thank you, Dr. Sarantakos.
Thank you so much, Matthew. So excited to be here with all of you today. I'll add a visual description as well. I'm a white non-binary person with brown hair, wearing a black and white checkered suit jacket in my office at home, very much like Dr. Kim, have been here for many, many years now, and have some framed artwork behind me. So just want to say for the group here and also the audience that my pronouns are she, they. And as I said, I'm a white queer non-binary person. I've also been directly impacted by the PIC in a number of ways. And by PIC, I mean prison industrial complex. And I just say that to share a bit about my positionality in relation to the topic of our conversation today. And prior to coming to academia, I did 10 years of social work practice. And in that time, I developed and directed a jail diversion program in the New Orleans Public Defender's Office. And it was my personal experiences with the PIC, also mixed with my professional experiences as a social change worker, that really drove me to deepen my analysis and continue this work. And so my research and organizing right now is focused on two things currently. The first is moving professionalized social change work to a more solidarity-focused model through pedagogy, research, and practice, and then also advancing caring communal approaches to harm and need that view all life as precious. And to the second piece of that about how I see punishment and harm entrenched, it's literally everywhere. It's the bedrock of US culture, of our institutional practices. And I'll share just a little bit about where my head is right now in terms of my work, my professional work and organizing, is that as a new faculty member who's been thinking and writing about how to move professionalized social change work's ethos and curricula closer to an abolitionist horizon, I see punishment and harm everywhere in higher ed. And so, faculty punishing students for late assignments, absences, requiring doctor's notes and detailed explanations for why they miss class or need more time to complete their work. Faculty also co-signing, really harmful processes of university disability services that put the onus on students to achieve, really particular official statuses for their learning needs to be acknowledged and met. And even honestly, like something that I'm really struggling with is maintaining letter grading processes that I firmly believe stifle learning and deep personal growth and intellectual growth. So that's just some of what I've been thinking about, but these practices don't come from, like all the practices that Dr. Burch and Dr. Kim have mentioned already, they don't come from a place of care, kindness, or trust. They're tied to a punitive logic, and a punitive logic drives so much of how USCNs function. And so I'll stop there and just say that's some of what I've been really kind of sitting with more and more as I do my work.
Thank you, Dr. Todić.
Yes, I'm also super excited to be here with this fabulous panelist. For my visual description, I'm a white femme with a vintage hair, one side pin-up and neon blue highlights and bright red lipstick. I have a white shelf behind me and white door behind me. It's all been cleaned up for today. I had a big suitcase sitting behind me just a few hours before. My research broadly focuses on health justice and health equity, but like all the panelists mentioned before, I see punishment embedded really in all systems, including healthcare. And I think of health as an embodiment of current and historical social and structural conditions. But more importantly, I'm really interested in praxis at this mezzo level inside of institutions that can, in some ways, build culture and infrastructure the conditions that maybe eventually can lead to health affirming places. But I think we really need to start at the place of infrastructure and culture. And I draw from practice and my lived experiences in my research. So before my current role as an assistant professor at UTSA, I was a social worker in a large academic medical center, which was a part of the safety net, meaning that large portion of patients were low-income, immigrant, and people of color. And my social work role was fairly atypical. I worked at the hospital-based domestic violence program with a group of fierce social workers and nurses who understood intimate violence as a determinant of health. And also I worked as a doula at a no-cost hospital-based program and managed social justice education for the entire academic medical center. So this role allowed me to move through the healthcare system in different ways and really see punishment embedded in policies and practices, but also to see liberatory efforts in those environments as well. And we can talk more about that later. I just want to give one example of punishment in the academic medical centers where I worked. So we adopted a universal screening for intimate partner violence, which means many of you probably seen this on your forms as well. When you arrive to the healthcare system, one of the questions is to ask you if you're currently in a harmful relationship. So this is potentially a good thing. Healthcare is one of the places where survivors go and are free to go and have some privacy to answer this question with confidence. So you can imagine that this could increase their capability to live a flourishing life because they disclosed and we provided care and kindness and reduced risks in their lives. But at the same time, this situation often produced more harm, especially for low income and people of color, because when someone discloses intimate partner violence, providers panic and see calling the police as the ultimate solution. So much of the work at AWARE was educating providers that intimate partner violence was not a reporting mandate. They only had few mandates, and intimate partner violence was not one of those mandates. The calling to police was likely to actually not address their patients' needs and ultimately create more harm. And that's just one of the many examples where a policy was in place that could potentially be supportive and life-affirming, but often actually ends up harming patients. When I left my practice in healthcare settings, I was really committed to focusing on upstream factors that impact health. So I started thinking about education as a determinant of health and a school to prison pipeline as a determinant of health, and really thinking about school-based restorative justice efforts as a health equity intervention. And there again, I saw a practice that potentially could be life-affirming, but without structural analysis and really dealing with the root causes, also becomes a behavioral intervention that is used to as means of social control for Black, Brown, Indigenous, and kids with disabilities. So I'll stop there. I think all of these practices experiences really led me to think about really this micro level life-affirming spaces that we need to really invest in building, including critical analysis that eventually may lead us to somewhere else. But we have to start with infrastructures and cultures as kind of the seed of the larger change.
Thank you so much, and thank you all. I think we could definitely spend the entire session just talking about harm and punishment in these systems. And one of the threads that I wanted to pull out to make sure that we keep coming back to through this conversation is how the practices and how the carceral systems get extended into systems of care and service, ostensibly systems of care and service, through practices and policies, as well as logics of punishment that are built into everyday society. And I think that presents a very specific challenge to building life-affirming institutions and creating systems of care. And so I wanted to pull that thread because I think it speaks to some of the ways that we intervene in these systems and how challenging it is, which really gets to the next question, which is for every panelist as well, and gets to the heart of our topic today. So this event is really motivated by discussions of abolition and abolitionist possibilities in social work across a variety of social service areas. Geographer and abolitionist Ruth Wilson Gilmore has stated that, quote, abolition is about presence, not absence. It's about building life-affirming institutions, end quote. So in your view, what are life-affirming institutions? And how does the goal of building systems of care, repair, or liberation show up in your work? And I know you've all kind of like gotten to touch on that, and I think we're all excited to hear more. So I think we'll go in the same order as before, if that's okay. Dr. Burch.
Sure. Life-affirming institutions. Not to defer too much to, I'm just going to sound like an anthropologist in answer to this question. But I actually do believe, and I think I believed this even before I was an anthropologist, that maybe the most important starting point for a life-affirming institution is to begin from people's lived experiences. And I know that sounds really simple, but it doesn't actually happen, right? And not only to begin from people's lived experiences, and when I say that, I mean, beginning from a deep, situated understanding of what someone is experiencing in that moment, as well as what they've experienced historically, right? But also, sometimes I think organizations may begin there, but then quickly sort of go off in other directions. So it's also about sort of constantly checking processes, policies against those lived experiences, a constant tacking back and forth. And it also just means actually trying to understand the world from the perspective of the people being served. In my experience, lots of people in roles of social service provision, and not to sort of put those folks on blast, because I think this is just true in the general population, right? Just people lack a critical understanding of why people do the things they do, right? So they just, not even a critical understanding, they just don't understand why someone might not take the job, why someone might not leave the gang, right? Why someone might evade the child support system. I mean, just there's a real sort of lack of understanding from the logics and contexts that shape people's experiences. So, I mean, here, just a trite example sort of from my most recent research in workforce development, right? And one of the organizations I was working with required its job-seeking clients to come to appointments for job coaching dressed professionally, right? And for them, that meant blazers, button-down shirts, ties, skirts, etc. Until, several of the clients who had worked in construction for many years pointed out that if they were to go to a job interview dressed in that attire, it would be ridiculous. And so if the point was to sort of practice dressing up for work, right, then they should come to those appointments in t-shirts and Dickies and safety vests, et cetera. And the organization just hadn't quite thought of it that way, right? And to their credit, they immediately agreed to this kind of revised policy that participants should dress for their desired professions, right? Not according to some generic standard of professionalism. I mean, that's a super small example, but too often there are sort of systems and programs designed that really are just sort of miles apart from people's actual realities. I'm actually going to stop there, if that's okay.
Dr. Kim, will you go next?
Yes. I realize being called Dr. Kim is stifling me. I don't want to get into, taking up time changing our titles, but I was like, oh, what is this feeling I have? So I'm going to, I refer to myself as Mimi. And I think what that gets at is like moving out of sort of this formality of this academic setting into the fact that, I think most of us here, we're motivated being here by the call to social work as a profession, as a field, as an academic field. And I think this question is really motivating for me and really important. And I don't think it's a question that would have been asked before. I think there would have been an assumption that social work is just good and we're all about social justice. I have to thank the moment of the uprisings of 2020, summer of 2020, for really calling this into question. That many of us were, I think some of the beginning chants that people says, defund the police, hire social workers. And immediately I think there was kind of maybe a happiness about that, but also a response that social work, that we had to really look at ourselves as social work, institutions of social work, and look at how tied we have been to carcerality without even questioning that. There was a whole series of debates that happened in June of 2020, I think, are really foundational to this moment where we can really call into question how life-affirming we have been. Do we even calling to evoking that language of life-affirming is something that we hadn't done very much in the past. And I really love that, because I think it just brings that kind of, what are we talking about? We're not just talking about doing good things for people, case management, ameliorating lives, doing a little bit better, that we really associated with so much of social work and haven't necessarily questioned as our task. I think calling upon something that's much more, maybe we can even say aspirational, but also has meaning in our everyday lives. What does it mean to affirm our lives every moment? What does it, for me, even just saying, I think maybe this of Dr. Kim, honestly, in this very moment was a little more life-affirming. And so I had to conjure that a little bit to try to make the best use of the short time we have together on a Zoom platform. So I don't necessarily have an answer to that. What I have is, what I want to bring up is the importance of that very question. That we really have to look at the fact that we do have institutions that have limited roles, and that's okay. I don't think we have to throw everything out. But I can say that in the work that some of I've been doing in transformative justice, in moving from a punitive kind of system of, well, on the one hand, support for survivors of violence, in some ways, an unquestioned support for survivors of sexual and domestic violence that was not available as a society before. We also turned to punitive systems, particularly in dealing with people who have caused harm. I think that a lot of us doing this work, I have to say that I'm just going to mention a time when I had to turn around a little bit earlier in doing some of the community accountability, transformative justice work that I've done through creative interventions and through my political work and insight. I had a chance to talk to folks that were doing this work in communities in Philadelphia with Philly Stands Up. They came out of a punk anarchist community, and they still, the people are still there doing the work, but the formation no longer exists. But when I heard how they dealt with accountability with people who have caused harm in their community, it was a firmness. It was with maybe we could say calling out to a certain extent, but they brought so much care to their work. And it was something that I hadn't done in my own work, that they asked people to be accountable, to at least show up and be there on time, but they also asked people how they were doing. Were they getting enough to eat? Did they have a place to live? Did they have enough money? And really centered their care for people who had caused harm and for survivors of violence and for everybody in the community as a starting point. And that, I have to say, blew me away. And I think what that told me was how central that is to all of the work we do and the very fundamental things that we so often forget, even in doing social justice work. So I just wanted to call them into the room because I learned so much from their approach. I still do. And it really made me think very differently about the own work that I thought was very liberatory, but wasn't really fully centered in life-affirming values and practices. Thank you.
Thank you, Mimi. I will ask, I mean, either Dr. Todić or Sarantakos, you can go next. I'll also, if you want me to call you by your first names, I'll do that once you tell me to do so, but I have my own logics in these kind of settings that I'm working under, so.
You can absolutely call me Sophia, please do. Yeah, I can add a little bit. I just want to say, again, so grateful to be here. This conversation is so, it's life affirming, dare I say. So this is incredible. And just want to lift up a little bit of what Mimi said in terms of just the practice of always learning, right? I know we're here to share our thoughts and ideas, but it's a daily practice of trying to be better every day. And the way that she said all that was so beautiful. I think it's just something I'll add is just that for me, life affirming institutions are an entirely different landscape than what we currently have, right? So, and I think about Ruth Wilson Gilmore's quote of "where life is precious, which essentially just means it should be abundantly clear when and where life is valued. And by life, I mean all living things, not life in an anthropocentric sense, but and in the US, and this again is a kind of a manipulation of a quote of Ruth Wilson Gilmore, but in the US, right, we put profits before people, we put warfare before welfare, and death over life. And life is not precious here. It's not precious. And I think the pandemic and the worsening climate crisis, and honestly, what Mimi also mentioned too about the uprisings of 2020 helped wake, I think, more and more people up to this truth. And now we're in this environment now of, sacrificing 1 million plus people to a dangerous virus and disabling millions of others so that the wealth of a few can soar. That's a policy choice. Continuing to chase profits and extract from our dying planet is a policy choice. And these are colonialist, white supremacist, racial capitalist policy choices. And all of these structures and choices are death making. And that is the weather we live in every day. And so to me, to be life affirming is to literally change everything, right? We have to center all living beings and the land and everything that we do, being in closer relationship with each other and trying to live in harmony. And I think that that's not something that we center at all in the United States. And then to just kind of translate that into my daily life and my paid work, of course, I think about life affirming in the macro sense, but I want to also kind of uplift what Jelena had said and also Mimi about this kind of micro sense of it too, of that I'm trying all the time to be better about treating everyone around me in life affirming ways every day, right? So how am I treating my students? How am I approaching them with care and support? How am I treating my partner, my colleagues, people I'm in close community with, and trying to do life affirming work in every context that I'm in, and not allowing the institutions that I'm a part of to be, I'll quote Hannah Bowman here, who is a brilliant abolitionist thinker, but not allowing the institutions that I'm a part of to be captive to the death dealing powers, right? So trying to interrupt that in every context that I'm in my day-to-day interactions. And, then I translate that, hopefully what I'm trying to do in my paid work is thinking about how we then, shift curricula that desperately needs to be shifted in professionalized social work so that we can stop the field from being a pipeline for carceral status quo workers. And what are the changes that need to be made so that in terms of research production, so that we stop problematizing people and start problematizing structures and start thinking in that way. So that's just a little bit of how I'm trying to translate that into my daily life and my work.
Yes, Matthew, please call me Elena. And Mimi, thank you for introducing that. I can immediately shift my body, relax, and get into my true self. So I appreciate that call. So I can relate to so many things that you've already shared. I want to go back to aware, because the hospital-based domestic violence program, because to me, it gave me the embodied experience of what it means to be in institutions that are harmful in many ways, and to have life-affirming spaces inside of them. Just having that embodied experience, that we can build that even inside of places that may seem impossible. So when I think about the AWARE program, the advocates showing up to somebody's room after they disclose intimate partner violence, our approach to working with that person was grounded in a heart. So I think about it as harm reduction. We didn't think we were transforming an institution by showing up in this way with the person, but we were building a caring relationship based on mutuality with that person. And that's the beginning of that transformation, shifting from power over in the institution to power with the person, and really being guided by self-determination as a means to safety, rather than sort of safety is what guides us, and then we determine what's safety. So what does the person really need? What Melissa was saying earlier, what does the person really need, and how do we guide an intervention based on their needs? So we would start the relationship by explaining that our role was not to make them leave their partner, but to work with them to reduce the risks and to increase access to resources that met their needs and support their safety as they defined it, not as the way we defined it. We invested in building a structural analysis together. We had this long table inside of our office where we had lunch together and really engaged in deepening our analysis of what are the root causes of intimate partner violence and how does that intersect with state violence and war. We grounded our work in intersectional feminism and politics. We continue to learn from survivors, and we shift our directions based on what we were learning. We learned from activists and organizers, even though we were working inside of the system, and social workers and nurses. I mean, I think about all the lessons learned from Insight and Northwest Network and San Francisco Asian Women's Shelter. I mean, those are all the places where we were continuously keeping up with new ways of thinking about how to intervene outside of the criminal legal system. We also built long-term relationship with survivors and were active partners in that process. So I worked primarily with immigrant women, sometimes for years, because addressing structural barriers that led to feeling unsafe in their lives could not be resolved in 3 meetings. So again, building an infrastructure inside of AWARE to allow for that kind of work with somebody long-term. And I have to say, in the vast numbers of cases, it meant not working or actively avoiding the criminal legal system. And we needed to really understand why that was important. And the only way to really understand that is to actually ask and listen, and to think about what does that kind of intervention mean for somebody that's not me. And I would say that experience really gave me an embodied experience of what's possible in other places, including now what it means to be a professor inside of a colonial institution, like higher education, that even though what Sophia described earlier, there's so much punitive policy and attitude embedded in social work education and curriculum, it is also possible to build alternatives. And so I'll end there, but I think really being able to hold on to that complexity and duality is really essential. And then for me, also thinking about what does it mean to try to build those kinds of spaces in my classroom? Because often social work students don't have those experiences in other places, but can the classroom, at least for 15 weeks while they're with me, be the space where something else emerges and it's possible, so that we know that it can be possible at a small scale, but then also gives us the courage to scale that up and think that it's possible, that a different landscape was possible in the future.
Thank you all so much. We're going to get further into this question of building life-affirming institutions and practices of care and liberation. But one of the things that I heard from all of you, I think, was in contrast to a logic of punishment, a real logic of community and lived experience grounding the building of life-affirming institutions, and within that, an ethos for mitigating the harms that currently exist within the institutions as we build something else. And that kind of leads me to the next question. And just so people are aware, I'm going to be asking more like people directly rather than the whole panel, but anybody can jump in if they have a response. But this next question is about how do we foster change in or build new models of social services, and really understanding the relationship between punishment and care within that. And because we know, and you've all spoken to how punishment and harm are entrenched in many service systems' daily operations, and that can create a lot of difficulties in changing these systems and building approaches that cultivate care. So how can the critical eye, the approaches that we take to analyze systems of punishment, really be leveraged towards creating systems of care? And I guess another way of saying that is, how do the lessons that we learn from studying punishment help us in this parallel project that we do at the same time of furthering care and liberation? I'm going to first direct that question to either Mimi or Sophia, but again, I welcome whoever wants to respond too.
I'll let you go first, Mimi, if you want.
Okay, I was waiting for you. Let's see. This question comes up a lot in the work that I do in addressing domestic and sexual violence. Of course, the anti-violence, as you know, and as I was saying, the anti-violence movement has been specifically tied to the carceral state, to policing, law enforcement, and has really contributed to the buildup of and strengthening of carceral systems through enhanced policing, through the creation of new institutions like victim witness programs, the community coordinated response, CCR, the things that have turned into SART, sexual assault treatment response, and so on, that we've actually contributed to carceral systems. And I think that's what makes it particularly instructive also in terms of learning from what we've done. In being part of Insight and being part of my own organization's attempt to come up with alternatives through creative interventions, which I helped to start in 2004, that we were really, really, really motivated in part by both the real concern about the absolute prevalence of sexual and domestic violence in our communities, in our families, in our friendship networks, in our organizations, and our absolute inability to deal with it without using carceral systems. I also was part of a lot of different responses that people in the social justice world had to sexual and domestic violence that actually took it out of systems of carcerality, but recreated systems of carcerality. It was just amazing to me how we reproduce the same things. I remember calling together a gathering of people to talk about how that had happened. I mean, on the one hand, people didn't care about domestic sexual violence, and people had to leave organizations and movements because they were just driven out. There was a huge amount of victim blaming. There still is. But at the same time, I saw that our attempts to try to do something about it also recreated things like investigations. Who's right, who's wrong? In some ways, as Paula Rojas said so many years ago, we just created cops in our heads. And it was so strongly institutionalized that in our own values and our own ways of thinking, that we used systems of punishment, we used systems of investigation. We looked as if we were outside observers of the truth and evidence, and we didn't do that. We didn't do it well. I know that a lot of us came with demands for immediate types of changes from people who have caused harm that weren't realistic. They weren't based upon a system that actually creates so much shame around both being a survivor victim of harm, but also those who perpetrate harm, that people didn't have any investment in trying to use a different way other than just kind of escape. I think this still is so much the case, and it does, you just have to keep doing the work, even though in so many ways I'm very disappointed by the lack of progress that we've made, despite now, some time in trying to move this forward. So I think that what we've learned a lot is about how we are reproducing these kind of systems of carcerality within our own kind of alternative social justice responses. We've also, done nothing about them, so that's also still very much there present. But I think that more recently, I do think that people in the disability justice movements, people in kind of these healing justice spaces, and this call to life-affirming institutions and life-affirming practices has really generated a lot more rich thinking about how we can move from this kind of like binary of perpetrator versus victim, of, we have to like cast you out. And I mean, let's face it, the calling out culture is alive and well right now. But how we can actually do things differently. And I think that we're still, we're still in kind of almost emergent phase of some of these practices, because carcerality is still so strong, because there's really not been any resources given to those of us who are trying to do this other kind of work, because a lot of us have refused to take some of the money that is available, because we know that doing so will only lead to control, co-optation, basically the elimination of the very things that we're trying to do. So there's so many ways in which we've had to be very, very creative, steadfast, and really relied upon our networks of solidarity to try to move forward in this work. I gave the example of Philly Stands Up in some of the work that they did around centering care as a response. I took a lot from them in terms of their really determined political work that they did for 1 year, 2 years, weekly, with people who have caused harm, in order to make those kind of long-term changes. And I think that those acts of commitment, their care for each other as a political institution and as a political organization, are very much, I still use them very much, rely on them as guidance for my own work of moving away from punishment and carcerality towards care, and yet firmness around and accountability around harm and violence.
I can add some thoughts rather quickly. This is such a great question. I think for me, when I try to process this question, which is so complicated, all of these questions are, I think what I wrestle with is that understanding the true purpose of the systems around us, systems that we're told are inevitable by folks in power, is key. And so I think I would argue that an abolitionist framework is excellent at helping us do this analytical work, because the framework of PIC abolition really pushes us to ask, well, what are the systems around us truly built to do? Are they actually broken, as so many folks are saying, or are they actually working precisely as intended? And then we can begin to uncover the answers to these questions, one, by learning, I think, the history of these systems and institutions, and then also, honestly, just exploring the data that shows their true intent. Right? If we think about family policing, Dorothy Roberts' work and the work of so many others have told us for years, right, that what this system is intended to do is to surveil, criminalize, punish, harm Black, Brown, Indigenous families. We can look at the statistics around police and how they actually spend their time and what they do, and versus the mythology that we're told about them actually creating safety, right? And so I actually think, related to this question, the defund the police movement is actually a really powerful example here, because this movement was, and I think continues to be, hugely successful, right? We had Joe Biden actually mention it in the recent State of the Union address, right? Which is is a big deal. It's a big deal that folks are having to say those words and have them come out of their mouth because they see it as a threat. And it's not necessarily successful, unfortunately, in defunding the police and defunding as a means to abolition, but I think in helping more and more people understand that police function as intended, and that it's not a broken system, and that spending over $120 billion on police nationally is actually a divestment from life-affirming institutions. It's a policy choice to invest in death over life. And I do think that there's something about the convergence over the last several years of, enduring racist state violence converging with the pandemic that really helped shift people's view of all of these things and kind of question things in deeper ways than perhaps they had before, right? Seeing police do what they do, which is enact violence and death. At the same time that, let's say they saw medical practitioners around the country not have the necessary PPE to keep them safe during a pandemic, right? And all of our so-called systems of care crumble around us. And so I think in that way, those analytical approaches are so critical in helping us understand how we actually build life-affirming institutions.
Dr. Burch, did you have something to add?
Yes, and Melissa.
Great.
Melissa for me too.
Yeah.
Thanks. And I also realized that I twice now have forgotten to give my visual description, which I will do now very quickly because this question is reminding me of it, because I'm going to mention my backdrop. But I am a light-skinned Black woman who wears my hair in an afro, and in my backdrop is an interactive popular education exercise that I developed many eons ago to help people build a collective analysis of the prison industrial complex, right? And so I really love this question. I would actually like to hear more sometime, Matthew, about where it came from for you. But it made me think about my teaching and kind of how I teach about punishment systems, and that one of the things I often emphasize is the value of analytic plurality, right? So in other words, to consider that there are different ways of making sense of a central set of facts, right? So if the central fact is that the United States imprisons more people right now than any other place in the history of the world, for example, right? Then the big questions are immediately that arise, well, why? Why do we rely so heavily on techniques of surveillance and control? And what are the larger political, economic, and social processes that drive the use of punitive strategies? And how is this reliance upheld and justified? What are the ideologies and beliefs that allow it to persist, even in the face of significant resistance, right? And there are different ways to answer those questions, right? And so I think we have to think, and I think there's value in thinking about all the potential answers to that question, to all those questions. And not only thinking about sort of which analysis do we find most persuasive, but also what are the political implications of those competing conceptualizations. So, where does it leave us? In other words, if we think about the punishment system as primarily working in the service of capitalism versus as if we think about it primarily as a project of racial subjugation, right? And so when in thinking about these big questions, these big systems of care or systems of punishment, I guess I think it's important to not be trying to hurry too quickly towards a singular explanatory framework, but rather to stretch our understanding. And this is kind of relating to what Sophia was just talking about what the system is and what it's for. And it has historically and is contemporarily about lots of things, right? It does lots of things. And I guess my hope is that kind of in pursuing this rigorous, critical, but also plural kind of analysis, we can ward off some of those overly simplified understandings, right? So I'm thinking about people's work, for example, like Damien Sojourner, a fellow anthropologist who calls into question the popular notion of the school to prison pipeline, right? By showing that, simplistically understanding public schools as institutions of care is incorrect, right? That public schools have never been life-affirming institutions for Black students, right? Or Carolyn Sufrin's work in San Francisco jails, and where she's showing that the fact is that for marginalized, like low-income, poor, pregnant women, jails have become institutions of primary care. So to me, it's about thinking about, rather than trying to sweep these complexities under the rug or wish they weren't so, we need analytic frameworks that allow us to kind of grapple with these complexities and confront them head on.
Yeah, and I'm thinking about that as a provocation for social work as well. And I think, Mimi, you brought that up as well, kind of the critical eye that we need to attend to is social work, and what is it for, and who is it for, and what does it do, especially as we have this conversation about the different systems it's entangled with as well. And there's probably lots of different answers to that as well. And I think, that also gets to a point of how that analysis can change over time as well. And I guess that speaks to the next question that I have, which is really about social work and social services and change. And I'll first direct this to you, Melissa, and Jelena as well. But in social work, we often have debates about systems change that center around and frankly often flounder in the tension between incremental change and more fundamental change to systems. And I've heard this kind of tension come up a bit in our conversation today even. And so the question really is, in this project of fostering more caring social services and related systems, can our existing social service systems be changed in kind of the framework that we're working in right now under life-affirming institutions? Can they change in that direction? And if so, how? And maybe if you have any examples of models or approaches that can serve as guides, which I believe many of you have already started to touch on. So.
Melissa, you want to go first?
Oh, I just rambled. You go ahead.
Oh my goodness, I've been thinking about this question a lot as well. I've been asking myself, can institutions, the way that we know them now, become life-affirming? And I think my answer is, I think that they can be less harmful. But I think what Sophia was saying earlier, it's a whole different landscape that we are actually need in order to have life-affirming institutions. So, I think about some of the examples of what I've been trying and I've been reading about, and I just think that the praxis is really essential. I think we have to try. I think about Martin Barrow's, the liberation psychologist framework of the reality is so opaque because the systems are so complex and intersecting and entrenched and historically grounded, that the only way to really know them is to intervene in them and see what we learn from that experience. And so, that's what I draw upon, the things that I have tried in my own experiences in institutions, whether that's the higher education right now or healthcare setting, and also learning from things that are actually happening in the community outside of this institution. It's also a sort of accountability mechanism for what's possible. So I think about it as I've been starting to think about it as a continuum between what we do inside as harm reduction. And really, Mimi gave us this language, which I appreciate so much, that when we think about change inside of the institution, it's to me helpful to think about harm reduction, and then to think about life-affirming structures outside of the current institutions, and then we can work on those processes in simultaneously. When I think about what's been helpful in building life-affirming pockets inside of institutions, I think that the explicit analysis in critical theory and really looking at power and naming power is essential. So I really struggle with the idea that social work somehow can focus on social justice and not be grounded in power analysis. That just never made sense to me, and it will never make sense. So I think that that's an essential piece. I think if we really want social work to be part of transformation and to address issues of inequity, everything that we do needs to be grounded in power analysis, in intersectional power analysis. I also think that really focusing on building growth, fostering relationships is essential. And I think transformative justice and restorative justice work outside of institution gives us some frameworks for how to do that, how, from small interventions like being accountable, self-accountability, knowing how to apologize. And these are all the things that we can do inside of institutions as we build these pockets, while also imagine what happens outside of it. I think it's also really essential to think about how do we take power analysis and growth fostering relationships and put them in policies and practices inside of institutions. What would that look like? So again, to reduce harm, while also we build something that's a new landscape outside of it. So, and we have examples, I think, for example, about the Advancing in Social Work special journal issue last year. Cal State Long Beach MIMIS program gave us an example of how to move from multiculturalism in social work to critical theory as the foundation for social work. We started a anti-racism collective inside of our own department that's really grounded in transformative justice, and it's pushing an envelope, and we're learning so much from that because it's a lateral structure that exists inside of the hierarchical colonial institutions. So we're learning from that experience, both what can happen and also how harmful it can be even for people inside of it. So to me, it just seems like we need to ground ourselves in theory. We need to be learning from, millions of experiments that Miriam Kaba asked us to engage in. And we really need to be documenting all of this and sharing it as much as possible so that we can be learning from each other. I really think it's essential. While not, I really, for me, was a big part of my own journey to say, how can I think about this as a continuum, as I engage in harm reduction inside of institutions, and I think about life-affirming world outside of it that may or may not include the institutions as we know them.
So just to the question of fundamental versus incremental, I first kind of want to say I don't think we have to choose between those two. And people are probably familiar with critical resistance's concept of abolitionist steps, right? So I think of abolitionist steps as sort of fundamental incremental change, right? In other words, most change is incremental. If not all change is incremental, whether, sometimes the increments are big, sometimes the increments are small, but the main thing to be concerned about is the change moving us actually towards our goals, right? Toward the goal of whether it's prison industrial complex abolition or creating life-affirming institutions or what, is it actually moving us to that, or is it in some way extending or growing the systems and processes that oppress and disempower, right? And there are a couple of, so thinking about just kind of smaller incremental things that come to mind. And one, and I do take to heart what Mimi said about, not everyone can do everything. And I think that's absolutely true. But I do think that social service organizations need to be somehow actively working to confront the systems that have contributed to people's lack of well-being, right? So I don't actually think it's enough to only be providing the things that people need, even in ethical and caring ways, that we have to also be working collectively and collaboratively, with those who are most impacted or who have been impacted by institutional harm, to kind of analyze, as Elena was just saying, the reasons why they don't have what they need in the first place, and organizing to help people get it, right? And I agree that, I mean, that means that political education, critical analysis has to be an integral part of programming and service delivery. I actually think we need to consider sort of re-envisioning social service, like sort of frontline social work, social service work as political work, right? That it would be in the job description. It's a key part of the job criteria. If you want to provide services, you need to, at bottom, be able to articulate a pretty sophisticated analysis of the origins and root causes of the problems that you're hoping to serve around, right? And I think all of that is related to my third little thought, which is about the structures of funding, right? So, you know, so many organizations are tied to funding structures that kind of myopically focus on singular issues and measurable outcomes at the expense of more holistic approaches, right? Like the ones we're describing. So, you know, it's just too often that organizations actually can't provide the things even that they know people need, or spend money on and time and energy on organizing, right? Because the grants they're operating under actually don't allow that. And so I think that that has to be addressed too. It's important, as we're sort of pointing the finger at, you know, who needs to be doing what, you know, that we go as high up the sort of food chain as we can to think about where the problem of non-holistic approaches or non-life-affirming approaches, you know, where does that originate, and why is it that we feel so constrained in the work that we do?
Oh, I'm so excited about what you just said in so many ways that I could respond to them, but I did want to put a plug for a few things. I love this distinction between social service work as political work. And we could get into, you know, at another time in social work, we could talk about the move from generalist social work practice to very highly specialized practice that moves people away from the broader mission of social work at times, which is supposed to be more political. It also makes me think of, Mimi, some of your work on structural competency and the idea of having a lens towards structural systems of oppression, no matter what kind of level of social work you're doing. And I would encourage people to look into structural competency as a way for social workers to try and bridge the service with the political. And I'm also putting in a link for 1 million experiments, because Jelena made me think of this. Talk about abolitionist steps. A great website towards community-based initiatives of care. But your last point, Melissa, makes me think about funding and nonprofits and a lot of systems that social workers have to engage with in order to do their work. Funding, right? Nonprofit structures. And I want to ask this question of Mimi first, because it really relates to the nonprofit industrial complex. You know, many social workers have to collaborate with the state directly, or they do so through public-private collaborations, through nonprofits and contracts, and Mimi brought up contracts earlier. In contrast, abolition is really critical of the state, as we know, and often advocates for more community-based approaches to care. So I'm wondering how this tension between state-based and community-based services or otherwise shows up in your research or work.
Yeah, thank you, Matthew. I'm so deep in this these questions that I'm not sure how articulate my response is going to come out, because it's just something that I'm like in the soup of it. I think it's such an important question. I'm just going to refer a little bit, like in my domestic violence, sexual violence work, you know, I covered a historical period when we were very much like constructing on, I think the term that made sense to me was the carceral creep, right? We took community-based, somewhat autonomous organizations, some of which were just emergent at the time, and then tied them to state institutions out of a sense of protest, out of demands for, you know, system caring. So I saw that, but it's interesting seeing now as people are trying to like decarcerate and take themselves away. yeah, one of the ways in which people have been talking about doing this is like turning to, well, transformative justice. Hey, let's do transformative justice everywhere in systems. I'm like, no, absolutely not. Transformative justice is absolutely not a system-based response. Then restorative justice, people are like, well, what about restorative justice? And one of the things that it doesn't quite directly answer your question, I think, Matthew, but I just think that it's something to be aware of, because restorative justice now has been called upon as a kind of solution for many people to carceral systems. We're going to create these alternative justice systems to deal with harms or crimes or conflict and so on, that people have been in many ways, I mean, I think abolitionists are highly critical of this, but a lot of other people who think they might be coming from at least an anti-carceral or abolitionist lens have been kind of buying into this thing of restorative justice in and of itself is going to be an answer, where it really calls to so many different kinds of practices and responses. And so many of them are going to be pressured to be tied to law enforcement or even, school systems that are very much carceral. So what are the ways in which you might leverage responses to mitigate against the greater harms, but how much are you then legitimizing or colluding with carceral systems? And I just think that we cannot be critical enough about this. So I found myself writing an editorial called, it's like carceral creep as a dance, but also restorative justice and the dance of the devil, which, I mean, it's very, I use the words of Mari Matsuda, but what I found is that a lot of people that are now concerned about carcerality then are saying things. For example, the latest reauthorization of VAWA has a piece in there like, oh, let's do something that's restorative justice that's actually outside of law enforcement, but the way that it has been written, and I'm afraid the way that it will be implemented, I think is quite dangerous. And yet so many people were trying to get people who were abolitionist oriented to say, isn't this a good thing? Isn't this got to be a good thing? And we uniformly said no, and people just didn't get it. And so that editorial was written in a way to try to articulate the response that we had and how that we were put in this position that to many people didn't make sense. Like, why wouldn't that be a good thing? So I just want to turn to that kind of area of work in being, I think, very important, informative, and dangerous in terms of community-based organizations thinking that they might take something that looks like an intervention or interruption of criminalization, but that is so prone to be a way of expanding, legitimizing carceral institutions. Yes, Critical Resistance has a really amazing infographic that everybody should look at if you haven't, and have it in front of you at all times. But I see this at work right now. March 15th was when the VAWA reauthorization was passed. One other area, and I don't want to go on too long, but that I've been really interested in lately has been around mental health crisis response. Now, this is not an area that has been my area of expertise, but what I saw was this way in which this seemed to be an area in which jurisdictions were willing to do this kind of like, oh, let's move away from the police. The police are killing a lot of people in response to mental health crises. And there was kind of this, a little bit more of a buy-in in terms of the, those in power to say, okay, well, we'll look at this area. And it's been really fascinating in that I wanted to see what I thought we had to do some pretty quick analysis of an area that's pretty complicated because it has to do with systems of dispatch, the highly professionalized combination of security and mental health crisis response that involved EMTs and psychiatrists and clinical social workers and, kind of a gamut of these licensed positions that weren't necessarily within the police, but were very much tied to carceral systems and were seen as kind of a panacea to this, what many people, even the police, were saying, well, we didn't really want to do that work anyways. Please take it, but don't take any of our money and don't take any of our power. And that's what we see, not surprisingly, in jurisdiction after jurisdiction. I think what's interesting is to see the different ways in which these strategies happen. Also, the different ways in which those alternatives, non-police alternatives, are so limited in that they are constructed in psychiatric and social work systems that have not been critical of our ties to carcerality, or the ways in which mental health systems are very punitive, surveillance-based, stigmatizing, controlling, and very carceral in their licensing and the laws around policy making around how they operate. And then the ways in which some organizations, and I would say Cahoots is one of them, they do have some relationship with law enforcement, but they have over 30 years constructed some, I think, lessons for us in how they've used a less professionalized, non-clinical system of responders who are highly trained to take a much more kind of, I don't think they call it harm reduction in particular, but a different kind of response. I also see how they rely on a mental health system that is a little bit more liberatory. And what we find in so many of our jurisdictions is a reliance upon mental health systems that are completely industrialized, tied to law enforcement. And so that there's such a weakness in the conditions for a lot of our people that are abolitionist oriented, who are really care about using this moment to create an alternative response system, to come up with something that's very alternative. Now, people have been, I do want to put this, the report that was written as, one kind of source of information for folks, but we do see APTP in Oakland and Sacramento, which is the anti-police terror project, that have been really organizing to create an alternative mental health crisis response within communities, and a rapid response. I think we can learn a lot from that. We can learn a lot from some folks in Denver, not the system, but those people that are I can't think. They're listed in the report. I can't think of
STAR program, I think.
Yeah, the STAR program has become quite carceral. So it was like this very friendly chief of police that actually was very interested in keeping the police force intact, their money intact, and using a co-response system, which is co-response meaning police and mental health system strong, while also giving some credence to this other supposedly alternative system. It's really, if you look at the report, you can just see the beginnings of how that was unraveling and how the system of community control is unraveling. Anyways, this example has very much pointed out the limitations of the kinds of community-based responses to mental health crisis that we have in place right now. The need to really not necessarily tweak those that are there in place, but to actually create alternative responses. I do think this is very important. And again, I feel like this is really emergent work for me and for a lot of us just doing this. And interrupting criminalization is holding a lot of these conversations and spaces. So I urge you to keep looking at their website for all the knowledge that they've been churning out on this very topic. Thank you.
Thank you, Mimi. And I've so enjoyed attending those interrupted criminalization events. And one of the things that is so great about that and ties in social work, I think, is that social work needs to be in the business of understanding how the processes by which we set up these new programs and initiatives and the decisions that are being made around the connections with the carceral state or not, and the policies and barriers that are in place around those decisions. And then, of course, how that can change over time as well. So I really appreciate this response about kind of the decisions around partnership with the state or carceral entities. Questions are coming in from the audience. Thank you. I want to ask one more kind of pre-made question, and then we will get to those. But please, audience, please keep sending those in. This question is really about more the spirit of the Conversations Across Social Disciplines event itself, which is really about promoting interdisciplinary scholarship between social work and the social sciences. And I want to bring that interdisciplinary lens to the topic of today of building life-affirming institutions, and what is or what could be the relationship between the interdisciplinary scholarly research project and this project of liberation, care, repair that we're speaking about today. And I welcome Jelena, Melissa, maybe Sophia, whoever wants to speak.
Okay, I'll start. I just have something very short to say, which is to basically applaud the question. I recently reread one of my favorite articles of all time, titled Anthropology and Liberation, by Edmund T. Gordon, one of my mentors. And in that, he writes sort of a motto that I live by, which is, intellectual production, which is not instrumentalized through praxis, has no liberating effect. Intellectual production, not instrumentalized through practice, has no liberating effect. And in the article, he's discussing sort of the various factors that limit the liberatory potential of academic production, of ideas produced in the academy. And one of the key ones being the political economy of the academy that rewards publication in scholarly places that no one has access to, grants, and to a much lesser extent, teaching, right? But another of the factors that I think is relevant to our conversation here is that as scholars, and even as radical scholars, we often lack access to the institutions that could convert ideas and knowledge into action, right? And so I was just thinking about that, leading up to our conversation today, in the sense that I just see great potential, really, in active alliances between people conducting research and teaching and people who are actually embedded in public institutions, community-based or otherwise. And so to me, the question is kind of about how do we actually foster those relationships and break down, address those questions of, whether it's funding or political economy. I mean, they're all sort of the same questions that we face in all these locations about how do we actually do what it is that we see needs to be done. And I think there are a lot of things that prohibit or just kind of thwart or, make difficult, I'll just say, that make difficult the kinds of collaborations that we would like to pursue. So we need to identify what those problems are and sort of figure out how to overcome them.
I think something I'd add, I really, really like that, Melissa. It's such an interesting question. I hope my answer doesn't make it seem like this is like oversimplifying it, but I just think about, when I think about that question, I just think about how we all need each other, right? Like we all deeply need each other, because liberation, upending all of the things around us that are causing so much harm and destruction, it's a collective project. And I think so much of what's lost, particularly in academia, is, and this is not for everyone, right? There's a lot of us that have been personally impacted by these things, or deeply care, right? It's not necessarily that we have to have, proximity to the things that we are looking into necessarily, but just, I feel like sometimes, especially being new to academia, there can be like a real disconnect of people forgetting that they're also humans in the world that they're researching, right? And that there's like this forgetfulness around that, and that in fact we're all workers laboring in different settings, and we're all human, and we're all living on this planet trying hopefully to make it not just more livable, but a place where we can all thrive and have what we need to thrive. And so it's it's a collective project. And that means that everyone has to get in there. We have to upend any sense of hierarchy, any sense of, elitism, all these things, and just come in community with each other and approach each other with the skills that we have, to try to do this work collectively. And so that's what I think about when I think about that question.
I'll just add one, and I don't know if we're going to have time for dialogue, because this is something that's been a lot on my mind when I think about interdisciplinary work, is a lot of people are talking about it as something that we should be doing as scholars, and that the solutions to complex issues are, in all these different places, in these different bodies of knowledge. But one of the things that in my experience is also true is that that's extremely painful and often impossible unless we have the shared paradigm, epistemological understanding of what is the root cause of our issues. And, this is something that happens in health equity work a lot. It's everybody's talking about it and interested in it, but not necessarily everybody shares a same structural analysis. And so you can end up being in transdisciplinary teams where you can really benefit from each other's knowledge because you don't share the analysis. And so to me, that's a really important issue that I don't see much being talked about, is when we build transdisciplinary teams, it seems that the essential beginning of that process needs to be, do we have a shared understanding of what is the root cause of what we're looking at? And we actually, in social work, we can, Melissa, you can talk about maybe what this looks like for you, but that's very clear that in social work and in health-related professions, we don't have the same analysis of the root cause of health inequities. And so, I feel like it's really essential. Yes, we need each other, and yes, nobody is disposable. And at the same time, transdisciplinary work is hard, even with the shared paradigm. I think it's a really important beginning of the question. Do we share an understanding of what the root cause is? And if we don't, we maybe should not be on that team together, because in my experience, it can really get in the way of advancing anything. The work is slow, but it can really be disruptive in a way that's unhelpful and wasteful. So I feel like beginning with the shared paradigm is essential for transdisciplinary transformation of anything.
Yeah, for the sake of dialogue, I'm wondering, Melissa, if you do have anything to respond in terms of this notion of analytic plurality that you were bringing up earlier, and how that might align with what Jelena is saying about a shared understanding of root causes.
Yeah, I think, I would have to think more about that. I think it's a little different, or I hope I wasn't misunderstood. By analytic plurality, I don't mean that all the analyses are equally valid and that there's no truth, or, I'm not, that's not what I'm saying. I just more am thinking about kind of really stretching our understandings, not being sort of too easily satisfied with this is what it's all about, and just going from, that understanding that the system changes over time. It's continually morphing. And there are, I think, some sort of fundamental aims that certainly that the criminal punishment system has always had since its inception. So it's not like it's changing radically, but kind of who are its primary targets? What are its primary strategies? The system is continually reshaping itself to grapple with current realities. And so we have to be, so I guess maybe that's where the alignment is. Like, yes, we have to be constantly studying and thinking about that, and not just sort of assuming that we've got it all tied up with the bow and carrying on, right? We have to be vigilant in kind of continuing to analyze together. And I would agree that anyone who wants to do work should find other people who they, more or less share an analytic framework with, just as a basic starting point.
If I could just add one last thing. I know, Matthew, we're eating into time. I won't say too much more, but one thing I just wanted to add, because I appreciate what Jelena and Melissa just said. I think there's also something that comes to mind when I hear what you all mentioned is Kelly Hayes repeatedly says, who's a brilliant abolitionist, Native organizer, writer, talks about how we can't organize people we have disdain for. And I think about that a lot. And I think there are clear boundaries around, we all have different boundaries about who we can share space with, what feels productive and generative and all those things. And I think that's incredibly important to think about. And in this work, and I think about this particularly around professionalized social change work right now and some of the momentum that's growing, is that, and I think about Erica Miner saying, right, that it's slow work in always urgent times. And so it's this idea of, we have to leave space, we have to leave room for coalition building, political education, and hopefully getting to a place where we do have and can build a shared analysis. And so I just think that that's like such an important part of the conversation as well as making sure that we leave room to be in dialogue with each other and expand our political understandings of root causes, so that we can actually build a strong coalition and invite people in to learn, unlearn, and do that work together. And so that space has to be there. And then also there are those boundaries of like, maybe it's not working in certain spaces and with certain folks, and that needs to be listened to too. But that work of political ed is so key, and leaving room for that.
Thank you all. Shared understanding towards praxis. That's a great way to lead us into the Q&A. We've tried to organize some of these questions. There's a number of questions that have come in around social work and social work education in this particular moment that I kind of want to start with, because I think it speaks to the maybe shifting paradigm that we maybe are speaking to in this conversation. So I'll read the comment from the audience member. I think many of the ideas you have all raised are central to social work academia, but in practice, most of our graduates go work in systems that are, as you have all noted, ultimately harmful and not life-affirming to their constituents and clients. Many social service changes require political change, more funding to alternative community responses, and less funding to carceral systems, for example. Historically, when social work has become more political, it has also been less well-funded. How do you suggest we approach this challenge as a profession, and how do we prepare our students to address this challenge? And then I'll add this other comment. Do you have any suggestions for social workers looking to get into abolition? So I invite anyone to respond.
Let me just try jumping in. I think getting into abolition is not a career track. So, I don't know that you meant that, whoever wrote that, but I definitely have been getting this question much more in the last couple of years. I think Sophia will answer this better than me because I've heard her do so. But I think that we have to think of our political work both within organizations and paid work and outside. That's the idea. I think a lot of people know that social justice kind of nonprofit industrial complex, if you want to call it that, really is going through very challenging times of implosion, some of which is extremely unfortunate, and some of it was an over-reliance, I think, on doing social justice work through nonprofit formations. That we just have to be very creative now, and I understand what we're talking about. For many people, the ability to get a paycheck and pay rent, and I don't want to take that lightly in terms of our need to sometimes do what we need to do to have a day job. I think that, but to think that you are necessarily going to have a paid job that aligns perfectly with abolition, I just think if you do, that's great. But I think a lot of us aren't going to. That we have to bring abolition and an abolitionist lens to the work we do, even in non-abolitionist spaces, which is many of our spaces. We may take some of, I've seen this happen with, for example, API Chaya, which is a nonprofit anti-violence organization in Seattle that has a lot of abolitionists working with it. I think the people that I talk to, at least, I know that they're going through changes all the time, but they have an understanding of that organization being very progressive, but not abolitionist, at least at this moment, but taking part of their work to build abolitionist aligned kinds of practices in transformative justice, for example. And then not saying, oh, we're so cool, we're going to call this transformative justice, calling it something much more modest, but actually being aligned with, the greater expansive political project called abolition. We have to do it in different ways. We have to do it in our volunteer work. We have to do it in political work that might be inside an organization, might be outside an organization. We have to do it in our daily lives in the way that we deal with our friends, family, loved ones, community, and ourselves. So, and everybody can do that right now. And probably many of us are doing it right now. So I think, I don't, that might not be a very generous read on that question, but I just think it's real.
Yeah, I echo everything Mimi just said. Something I think about when I, and if any of my students are watching, they'll, I think there's a moment probably of real heartbreak when, especially, teaching first quarter MSW students who come in, I think, thinking and hoping that professionalized social change work is truly life-changing. And I think Melissa said this really beautifully earlier, that if you're a social worker and you're engaged in these systems, then of course you're doing good work, right? And so there's this idea that we have to completely dismantle with students, and that helping them understand the rotten roots of white professionalized social work in particular, and understanding our deep ties to carcerality from the field's inception. But then also, as we think about doing this work differently, it's not only educating our students about the field and the rotten roots and the problems and how we continue to kind of uphold systems of oppression and harm, but that, I think there should be some strong boundaries set, right? Like, I've seen schools post on job boards, here's a job with ICE, here's a job with the local police department, right? And if we're telling our students that you can do good harm reductionist work, or even, dare I say, some folks say you can change that system from within, that's a bold-faced lie. That's a lie. Putting students to work with ICE is not going to upend ICE. It's just not. And, there might be some harm reduction happening in that space with particular folks with a particular politic in that space. But I think we need to think deeply about what it means to be a profession that creates a pipeline to these institutions and systems and keeping them alive and thriving. And that's what we really need to be thinking of the long game. And then just to kind of add to what Mimi said is when we think about the nonprofit industrial complex, which is another, large pipeline from schools of social work where we send our students, it's about understanding the limitations of that work, right? Paid work is not freedom work. It's just not. And understanding the limitations and what is the good work that can happen there? What are some subversive things that you can do in that space? And then I also talk to my students about, what Mariam Kaba says, when folks say, oh, I'm going to change systems from the inside, her first question is, well, who are your people on the outside? And I think helping students understand that of, you might be able to be subversive and you should be subversive and do these things inside, but who are your people on the outside? Are you working with people who are directly impacted by those systems that you're working within? Are you organizing with them on the outside to reach for more abolitionist horizons? Are you organizing your workplace when you see problematic policies in place? Are you doing all that work? Or are you just saying from 9 to 5, you go to this nonprofit job and that's the Lord's work and it's great, right? And so I think that's what we have to really tear that apart in social work education. And that's something I think about all the time and try to problematize for students.
Thank you both for responding to that. I want to bring in another question that speaks to, again, the moment what many people think of as the moment that we are in. I'll read it again. It seems we are currently and increasingly in the middle of a reaction against life-affirming demands, such as defunding the police and abolishing prisons or decarcerating the vast majority of them. Crime panic discourse is on the rise and undergirds many political campaigns. What is your advice for organizers, educators, researchers, advocates, etc., during these moments of reaction, and what should we focus on? Just a small question.
I wonder if Melissa can answer that. Sorry, Melissa.
Oh, I have no idea what to do. I don't know. I don't know. I mean, I'm no longer someone who's kind of at the front lines of dealing with those reactions. Maybe I am. I don't know. I feel a little removed. If anyone else wants to take that on, what comes to mind is just that we have to stay focused on our own agendas, right? And what we are trying to build and do, that slow work that Erica Miners talked about, and not be too pulled into constant reactions, right? I think the kind of work that we're talking about here in this conversation today is, I mean, obviously we have to deal with politics as it confronts us, but also, you know, things like building life-affirming institutions, those are very long-term sort of deep long-term projects that I think it's important to not have derailed by reactionary language or trends. But at the same time, there's more. So someone else say something else we should do.
Yeah, no, Melissa, first, yes, I completely agree. And I would just add also, to me, abolitionist framework is very helpful for minimizing the reaction. So I have to, have compassion and empathy for people that are reacting and are directly impacted. And at the same time, I feel like abolitionist framework is very grounding. It's values driven, it's long-term work. And I feel like it's every time I get pulled off into something else or derailed, it's a place to come back to and stay grounded and keep working towards the big picture and big vision. So I think that's one of the things that we can do. We still need to organize, but really thinking about how do we build internal and collective visions for where we're trying to head as a roadmap. And then that becomes a way to be like, okay, I'm pulled, I'm reacting, I can have compassion, I understand I'm a human being, and still I have a place to land back on because I know where I'm heading. And when I think about my trajectory to thinking about social justice work and social work, abolition to me has been the most helpful in that way. It's very clear. It's a clear foundation that I can always fall back on to minimize my reactivity and stay engaged in a way that I think maybe not in my generation, but I know where I'm heading for the next one and next few. So I would say really grounding, helping students and ourselves think about values, have a clear vision for the life-affirming world, and then from there building a roadmap that allows a place to always get back to when we get pulled into other things where that are life harming or life draining.
We have another question that I hope is helpful for people grappling with a theme that came up in this conversation of the tension between logics of punishment and logics of care, especially in accountability processes that we were talking about a little bit earlier. How do we balance the safety and care of survivors of extreme interpersonal violence with the humanity of the person who caused that extreme violence, or with repeat violent offenders? I'm thinking of survivors of domestic violence or human trafficking who are killed or nearly killed by their partner and or trafficker. I believe in accountability processes, but I worry about the safety of survivors and or prevention of future violent incidents.
Elena, did you want to respond to that?
No, maybe go for it.
I feel like I'm moderating away from myself. So sorry, Matthew. But okay. That's, that is it's an important question. I mean, it's a question that kind of goes along with what about the rapist? What about the murderer? Question that comes around, we can't possibly do abolition. I have to say that I have been, being in the anti-violence movement and work for as long as I have, it became very clear to me that we had a very, very strong foundation historically meaning since the, mid 70s, not really very long term, but that people who cause harm cannot change. That it is impossible. And that to think so is being foolish, is adding to danger, and is being part of the problem. That is a very, very strong notion. And so I also had to kind of liberate myself from that, because I myself was sort of socialized to think that way. And the fear factor is that if you don't think that way, that you're actually contributing to the lack of safety and danger, and you're part of the problem. And so it's a very, very strong tension. I have some empathy for people in the movement that are driven by that, because it's not just you're terrible carceral people. Sometimes it's about real care about real people who have been very seriously harmed. So one, I think that I think we have to have a framework that understands that change and transformation and accountability is possible for anybody. Does that mean it will happen for everybody? No. So, but if we don't have that framework, and it is based in reality, if we don't have that framework, then we're never going to have the kinds of solutions that look towards a horizon in which that's possible. Now we have all the conditions to go against that being something that's possible. The shame factor, the fact that if you even confess, if we want to say, if you want to be accountable to violence and you say you did something, you are subject to a carceral system. So that's one reason why you wouldn't want to do it. You are also subject to, or even within social justice, carceral systems. So that's another reason why you would not want to do it. So much of the work of transformative justice to me is changing the conditions and the practices that we have, so that somebody who's caused harm, and I'm not distinguishing between the most violent kind of harm and chronic, to that which seems less lethal, but to create the conditions in which somebody would see that it was actually in their interest to change. That's in their interest because they're going to lose things, but it's also in their interest because they have something to gain, like their humanity, like integrity, like the belief that there's meaning, connection to children. There are so many things that we have to orient towards, not just the fear of punishment, although I have to say that some coercive practice, not completely against coercive practices, just been talking about this. I think we have to get clear about what that means. I think if I just ask somebody, listen, you have to sit with me and talk about this, that is using some kind of a coercive mechanism. So, I'm going to put that a little bit to the side right now, but that I think that we have to get better at creating these kinds of conditions where somebody would see it, that it's in their interest, that is out of care and compassion, that it is also that you might lose something, that there are consequences to your behaviors, like that somebody hates you, that somebody wants to get away from you, that your kids don't want to see you, that you caused fear. But there are so many ways in which we have a society in which you're not given the grace and the space to look at, in a clear way, the actual consequences of your action, and that have the container of a compassionate community. And that doesn't mean everybody's going to be crazy about you or wants to sit with you. That's why these are systems of response. It can't be, oh, you as a survivor have to want to sit with this person or have to forgive them. That's not what this is about. Somebody might choose to do that. Somebody might choose that they do want to move towards forgiveness, but that cannot be the criteria for these kind of transformative processes. So I think there's a lot of clarification that we need to do. I think we've gotten better as we've been trying to do this, learning from our mistakes, but also creating kind of these, what does it mean to create those conditions? Who do we need to have together? Who's got to be willing to actually sit down and do slow in-person work, which is a lot of energy. It's a lot of emotional energy. But we have to create more resources and space and slow space to do that. And they have to be done collectively, because we need to do it collectively in order to have a lot of different places and spaces in which people might get that. And also to build in a lot of systems for safety, because those are also a necessary part of the work when we're dealing with conflict, harm, and violence, and the levels of violence that people are addressing in this very question.
Thank you. The final question, and I know we're short on time, so I think this belongs into the bring abolition into the spaces you are in vein. Is we live in this punitive world in society. We're in these social service organizations or in our communities. How can we be more compassionate, understanding, and trusting, and have that as a platform to build these life-affirming institutions? I think this whole conversation spoke to that, but it's a tangible thing where people can start perhaps as they leave this dialogue today.
I would say a couple of really quick things that I think are really important is I think what Mimi was talking about earlier is just first starting to examine our internalized carcerality and our punitive attitudes that are just part of our socialization for all of us. I think starting with ourselves is really, really important. And then I think it's really starting to practice at a small scale of how do we build conditions where accountability becomes easier for us and other people that we're in. How do we practice taking responsibility for our own actions in daily work? How do we learn to give a really good apology? How do we embed that in our classroom as educators? What does that mean for our clients if you're in practice? I think those are some great places where we can begin understanding how that connects to the really big picture. And I think it also gives a sense that actually some things are in our control, and that those are the places that we really, if we invest in that, actually we can see outcomes in much faster way, which then gives us the embodied experience of what we're working towards in the future. So I would say starting it with ourselves as educators, practitioners, and just human beings in the world.
Yeah, I mean, everything Jelena said. I'll add, right, like point folks in the direction of Mia Mingus's work. Who's an incredible disabled abolitionist, organizer, thinker, writer. And, she talks a lot about we have to get good at the small stuff, which is what Jelena just nodded to, right? Which is apologies, and how, I mean, frankly, if we just we look at ourselves, and I'll quote Morgan Bastakis, who's another organizer and thinker, who talks about how the systems that we're working to dismantle live inside of us. And so we have to be constantly reflecting all the time about how we interact with each other, even on the very small scale. When someone says something we don't like, or that rubs us the wrong way, or just these tiny harms that might happen in the day, or that we, perpetuate in our relationships, and being more open about naming those harms and apologizing for those things, and inviting people in, calling people in into an accountability process to talk about things. How are we ever going to tackle the big things if we can't tackle the small things? Right. And so that's so much of what Mia Mingus talks about, is that we have to get good at that small stuff. And it harkens back to what Mimi was talking about, that slow work and that slow interpersonal work. That's stuff we can do all the time, every day in our lives. And that's essentially, honestly, what abolition is, right? Is this ripple effect and this groundswell of us interpersonally changing and becoming more politically committed to upholding things that are life affirming for everyone, right? So like, I think that that's really such a core piece of abolition. So yeah, I think that that's a major piece of it.
I would just quickly add, and this is not to, maybe this might be unpopular, but I don't mean it to undermine anything we've said thus far, but not everybody has to be an abolitionist. Not everybody has to do abolitionist work, right? So I think just, I worry about sort of a pressure that people feel about that's the only thing to now be or do. It's a very specific and very radical political vision. It's not the only thing. So, I think just figuring out what you're actually about, studying, thinking with others, having conversations, and like everyone's been saying, thinking about how you are situated in the world and what you want to do, and just kind of getting clear about what that looks like for you, without sort of a feeling that it can only look a certain way or be labeled a certain thing.
I just want to say amen to that, Melissa. Honestly, it's such a big deal because I think right now we're in this moment, particularly in social work. I know we're over, but like abolition is becoming this brand and this thing that folks are trying to latch onto, right? And we're in a dangerous place with it. And it's really have a clear-eyed politic. Just have a politic that's clear-eyed and understanding the root causes of things. Who cares what you call yourself? Have a political commitment.
I have to say yes to all of that for sure. It's a great way to bring us to the end, Melissa. Thank you.
I know it's a closing comment, but I have nothing to add. I mean, all of that. Thank you.
Thank you all so much. I hope the audience feels invited in by those final comments to take the lessons from this where they will in their work and life. I want to thank all of you so much for your contributions. This has been a dream panel for me, and I hope for those who have attended. And I'm just honored and grateful for this conversation and for all of your work. And I thank the audience so much for attending and hope it was helpful and enjoyable and thought-provoking. Thank you so much from the School of Social Work and from the Conversations Across Disciplines event. And that's it. Thank you.